Welcome, Dr. Santa Maria.
I believe this is our third official mental health summit, and I can't tell you how excited I am for our continuing efforts to pull everybody together. This outreach, this ability, this opportunity for us to connect with you all is so exciting for us from the VA. And what we've seen over the past 3 years is that we are developing really strong collaborations with you all. And so this opportunity is just a great chance for us to put faces with names and make more contacts and continue our mission, which is, of course, to serve our veterans in this community and their families. And it's a great mission that we have. So I'm just so thrilled to be able to spend time with you all today. We have approximately 100 people registered, which is a great turnout. And one thing that's unique about this time is we, by the magic of modern technology, are going to be connecting with two other sites, Jasper and Carbondale. So, and all of this, I might add, is brought to you by USI. So I can't thank enough the USI folks who were willing to collaborate with us, help make all this happen. They've taken played a big role in making things happen today. So we are very grateful for this opportunity. Also, we want to thank some of our other community partners, our sponsors who helped to facilitate the lunch and make sure that we have some special amenities today. So if you get a chance, let our sponsors know that you appreciate their efforts, as well as the USI folks. The USI folks are around, and just let them know how much we appreciate that. Also, a big thank you to Nikki Krusty, who loves this kind of thing. This is in her blood, and she is excellent at it, as well as Daryl Garman. So again, very thankful that they were able to pull this together. And I would be remiss to not also mention Dr. McZanik, who has come over from Marion to be here with us today. And obviously, without her blessing, none of this would happen. So thanks to all of those folks. So again, without any further ado, just take this opportunity. We're all mental health, most of us all mental health professionals. We love this collaboration. We're part of the soft sciences, right? So this just makes us all glow and thrive. So take advantage of this opportunity today, and reach out, introduce yourselves, and spend time networking. In addition to the great trainings that we have today. So again, thank you all so much for coming.
Good morning. I'm Dr. McZanik. I'm the Chief of Behavioral Medicine. First of all, I would like to thank all of the veterans that are here for their service to our country, and also for being here to help other veterans on their journey to recovery. I'd like to also thank any family members of veterans. As a VA, we do our best to hire veterans, and we have many veterans on board as staff. I'm sure that other organizations also have veterans on board. I'd like to think this is a good opportunity to put a plug out there for ending stigma in mental health. In order to get better, people have to actually get treatment, and I believe too many people in our country do not seek treatment for mental health and addiction issues because of this. These are brain-based diseases. Recovery is possible. I've been doing this starting in 1982. I see people get better all the time. And may remind you before we finish today that I think everyone here, whatever your walk of life, can help end stigma to get people into treatment. Because we have way too many veterans, active duty, military, and civilians killing themselves every day, and also dying of accidental drug overdoses. Starting every meeting at the VA, we read the empty chair story regarding putting the veteran first. Now, it's possible I may have to bring this up here so I can see it. And this is written by a veteran. The empty chair. I wonder how we would react if at all our meetings there was an empty chair, would we look away or possibly turn and stare? But why would we bother with an empty chair? If all it does is elicit a stare, can an empty chair speak or convey thought? Or is it just empty and thus should never have been brought? But what if the empty chair was an unspoken vet? Could we ignore his presence without feeling regret? It's a powerful thing, the empty chair. It doesn't have to speak, but we know it's there. As a chair can't speak, it has no choice but to rely on us to become its voice, anonymous. So we need to keep that in mind with all of our community collaborations. Thank you for coming today.
Hi, my name is Nikki Krusty, and I'm the local recovery coordinator for the Department of Veterans Affairs. As Dr. Sanabria said, we want to welcome you to the 3rd Annual VA Mental Health Summit. Last year, 144 VA facilities across the United States hosted mental health summits, and there were over 12,000 people who attended these summits across the U.S., with over 60% of these participants having been people who were from community-based agencies and organizations. Our 2014 Mental Health Summit was a huge success, with over 120 participants attending. And last year we focused on strengthening military cultural competencies. We provided information on how you all in the community could help get veterans enrolled in VA services, and helped to talk about what all services we were providing, so that when you ran into a veteran and they said, this is a need that I have, the community partners were able to know how to do the connecting. We also talked about educational and employment opportunities. But one of the most positive outcomes that I think came from last year's summit was the collaborative effort that occurred between the VA and, help me get this right now, Southwestern Behavioral Health. Is that what the Mental Health Center is? Anybody here from there? Did I say it right?
Yes.
Yes, very good, very good. And the court systems, as we've been able to establish our first outpatient court commitment for veterans who had been experiencing multiple inpatient psychiatric admissions. So this was a big step for us, and I want to tell you that the veterans that we've worked with have not been rehospitalized since getting them involved with the outpatient commitments. We took note of the fact that veterans themselves wanted to be involved in helping to identify their own mental health needs. So staying in line with true veteran-centered care, we decided to focus much of this year's summit on veterans themselves. And I want to applaud the courage shown by the 3 veteran speakers that you will hear today. The common theme that I heard from all 3 of them was that they had the desire to share their own stories so that other veterans could be helped. Again, I want to thank USI for partnering with us in order to allow our community this opportunity to collaborate, to bond together in helping to provide services for our veterans. Thank you.
Good morning. Is everybody ready? I'm not, so you'll have to bear with me. I come all the way from Santa Claus and I have to stop in Boonville, get some coffee and rest a minute and continue driving. Last year at the summit, if anybody was actually here that's here today, we spoke about the National Resource Directory, and there was a handout that was given. This website really is kind of a miraculous little website. It's a resource for providers and for veterans. Are there any providers here today that have registered with the National Resource Directory that are online with that at this time? How many people in here actually attended last year? got a few, so we got quite a few new ones this year. Is anybody in here actually utilizing the National Resource Directory or even heard of it at this point? No. You are? Are you finding it very helpful?
I'm an educator, and so when I have students who are vets, I can refer them to that. So that's valuable.
Great, great. Well, if you guys get a chance, please log on to the website. You'll find it at www.benefits.gov/NRD. It's pretty neat. Have you found it to be helpful with the students at this point?
The ones that report back that they do like, that they've been able to connect with some resources.
Okay.
Sometimes it's very specific things like, I don't know, relationship issues or something like that. And so I can refer them to.
Okay.
So sometimes it's very specific.
Great. Well, I'd really like to encourage everybody, if they have the opportunity, please take a look at that website. You might be surprised what you really find in there as far as resources go here in Edinburgh County or the counties that you are actually from. One of the things about the National Resource Directory that I wanted to kind of reiterate here is that it is the United States government interagency web portal for wounded warriors, service members, veterans, families, and caregivers and providers. It will provide information and links to thousands of national, state, and local resources. It was established to support the reintegration and recovery and rehabilitation of our members of the United States Armed Forces. It's one that we use over at the VA on a daily basis. In my position, I am a peer support specialist in behavioral medicine, and I am also a veteran from the United States Air Force. And on top of that, I am in recovery, mental issues. Let me turn my page. Some of the benefits that they do have listed on there to using this is you're going to find resources for the federal, state, the local government agencies. You're going to find resources for veteran and military service organizations, nonprofit and community-based organizations, academic instructions, institutions, and professional associations. They are always welcoming suggestions. They have a place on there where you can actually contact them if you would like to get registered or if you'd like to make any recommendations about the website. And there are handouts out front, so if you would please get one and take a look at that when you do that. I appreciate it. Thank you.
Good morning, I'm Deborah Walker. I'm the lead patient advocate for the Marion EPA healthcare system, and I'm also currently one of the 4 choice champions for our system. I was asked to give you a brief overview of what the choice program is, and it's not the most exciting topic of the day, so I'll try to get through it and give you some helpful information. Last August, President Obama signed the act for the choice program. It's actually the Veterans Access, Choice, and Accountability Act of 2014. It was signed in August, and by November 1st, we were mandated to start the program. So the whole United States, all the VA system, by November was trying to train and start this program, let you providers know about the program, and get the ball rolling. The eligibility for the choice program requires that the veterans have been enrolled in the VA since August 1st of 2014. So if a veteran is coming in today and has never registered with the VA, they're not going to find themselves eligible for the choice program. But if you registered 10 years ago and never used the VA, you're eligible for this choice program. The other requirement is that the veterans are honorably discharged. Whoops, sorry. that they're honorably discharged, and that they served as possibly a reservist for more than 24 months in non-training purposes. As I said, we started the program in November. Veterans across the United States were mailed information about the choice program and the basic eligibility requirements. It's a little card, like a credit card, with the papery ones like the gas companies and the credit card company sends us all the time. Well, that's what they got. It's a choice card and it has the number of the third-party provider, which is Tri-West for our region in the United States. The program initially has some basic requirements that the veteran must, well, let me back up, I'm sorry. The basic requirements I told you were the honorable discharge and the in the system already. The other requirements are that the veteran lives at least 40 miles or less to any VA facility. If they live more than 40 miles from any VA facility, then they're going to be eligible for the choice program automatically. And the most confusing part of this has been that a veteran thinks it's to the Marion VA facility or to the Danville or to the Indianapolis VA facility, but it's not to the parent facility, it's to any VA facility. So for our veterans who live up in Effingham, they think that because they're 80 miles from the Marion VA, they're eligible. They're not. They're only 15 miles from the Effingham Clinic, or even Danville. So when you try to help someone understand that requirement, it's to any VA facility, not just the parent big hospital facility. The other way a veteran can be eligible is if their future appointment is more than 30 days out from a clinically indicated date, and the clinically indicated date is the date that the provider and the veteran determine you need to see this doctor by this appointment. And if a veteran finds that their appointment is more than 30 days out from the clinically indicated date, then they could be eligible also to use the choice program. And things are going much more smoothly now. We've been doing this for a while, and our third-party administrator's been doing it for a while. Emergency care is not covered under the choice program. It's for scheduled appointments, scheduled behavioral health appointments, scheduled primary care appointments, dermatology, ophthalmology, those kind of things, because there does require an authorization at the front end. Veterans think it's a card that they can take and just use anywhere. And I've had veterans come in my office and say, I took my card to the emergency room and I showed them my card and everything went fine, I haven't been billed, and then I have to tell them, well, you're probably going to get billed because nothing was authorized by the VA, and it's not good for emergency care in the first place. So it's for scheduled appointments. The authorization starts at the VA saying a veteran is wanting to see an ophthalmologist, but it takes 60 days to get in at the VA. Then they would call a third-party administrator. They're going to opt to use their choice card. And the third-party administrator will wait for us to transmit their name on a list, which we call our Veterans Choice List, that says, yes, they are authorized. And then Tri-West, our third-party administrator, schedules them out in the community with you guys, or if you're contracted with Tri-West, or an ophthalmologist in the city where they live. So those are the two main, the distance. The veterans that are more than 40 miles don't even have to talk to the Marion VA. They can just talk to the third-party administrator and schedule their appointment for behavioral health. The ones that are the 30 days, we have to put them on that list, not a wait list, on the list, and authorize their care. The services include their travel, if they're eligible for travel. If a veteran isn't eligible for travel on a regular basis, they're not going to be eligible for travel under the choice program. They know if they're eligible or not. So it's not something anybody would have to worry about. They can check with the travel office if they're not sure. Their care that they receive through the Choice program will be for an episode of care. So if we refer them to one of you for behavioral health and the appointment's scheduled and you require some kind of testing, that's going to be included. They're not going to have to come back to the VA for x-rays or labs or something you're wanting to monitor, or these outside providers are wanting to monitor. That's part of the Tri-West package. So at the end of all their care, then they bill the VA. So you guys, aren't flip-flopping back and forth. Once they're with Tri-West, it's going to be scheduled and taken care of through Tri-West. And that's new for us at the VA because it's very normal for our veterans to receive a non-VA consult, and then we bring them back in for x-rays, we bring them back in for labs, and send it back out to the specialist out in the community. But that's not the case. The other thing that happens with Choice program, once they've met with a provider and the tests and the plan of care developed or the colonoscopy is done, then that episode of care is done. And for the next instance with Choice, they start all over again. It's a new authorization for another specialization, and there we go again. So veterans still think the card is that, like I said, that card that they're going to be able to use to go anywhere, anytime, but it's not. It's for that episode of care, and then it's done, and if they need it again, they're welcome to use it. Starts all over again. I kind of talked about that. The providers who work with Tri-West have to meet some of the same requirements that our VA providers do. Obviously, licensed providers and all the correct credentials and licenses for your specialities, and your program has to be available to the veteran in a timely fashion. The reason we're sending them out is because we can't get them in within 30 days. So if you do contract with the VA or the dermatologist contracts with us, they have to be able to provide that care in a timely fashion. One of the main purposes of this act was to ensure that veterans are on wait lists. And that's what the card looks like. Like I said, it's one of the little cardboard credit card looking, but it's got the phone number where they call. And we talked about the 40-mile group. They are to the nearest facility, and that's the main thing anybody needs to remember. And if they're not sure, they can contact the Choice Champions at the Marion VA. 30-day group, remember it's not for emergent care, but they can't be seen within that clinically indicated date that the doctor and the patient agreed upon for that type of treatment. Then yes, they can opt in and use their Choice card. I don't really want to go into a lot of co-payments and all of that, but what happens with the Choice program is the third-party administrator is going to be doing the billing for the episode of care. If there are co-payments aligned with a veteran's outside insurance, those can be collected at the time of service, like a $20 co-payment. But the VA is not going to charge it. We will bill, if they have a co-payment with us, we will bill them later. Not all veterans are created equal. Some don't pay anything. Some have service connections that connect them from co-pays, and sometimes those veterans pay for other conditions that are not service connected. So I mean, it gets complicated, and I refer those to the billing people. And I think you guys don't want to get involved in it either. These are some website, some links that I wanted to share with you. You can read about the choice program, and down at the bottom, for those of you that may be interested in finding out what you have to do to contract with us, with TriWest for the program, it's listed there. I wanted to give you my telephone number too. If you have any questions that I can help you, please call me, and I'll give you my email address also. My phone number is area code 618-997-5311, and my extension is 55615. My email address is Deborah, DEBORAH, .walker2@va.gov. And if you have a question, and if it is about billing or it is about something that I can help you, there are 3 other choice champions, and we're all kind of divided on what our specialities are. One will be more involved with scheduling and getting veterans on the list. Other may be involved with the tail end of the process. So I'll be happy to help you, and I'll help your veterans in any way I can. I just want to close by saying that I work with the veterans when they're at their best and when they're at their worst. But one of the biggest changes and the biggest things that I see in my office every day are veterans who have behavioral health issues and are experiencing changes. The change may just be when they hear someone say, "This is normal. The way you're feeling is normal," and there are providers that are trained to help you with that. And there are groups that work with veterans who are experiencing the same thing. You've come to the right place. When veterans are in our facility or in your facility, when you speak the language that helps them move from thinking they're just totally the only person in the world feeling what they're feeling, and realize that this is normal and this is what many veterans feel, or there's help for a substance abuse program they have, and people understand and don't judge them, just help share information. Their lives change, their faces change in my office, and I don't really care how they get there, but I tell them we're glad that you're here, and for me it's thrilling to see the Vietnam veterans coming back now. The OEF, OAF, and the more recent veterans have had some programs, but the Vietnam veterans are seeing it too. They've been away for a long time, and they're starting to come too, because they're hearing about groups, and they're hearing about counselors who are trained, social workers who are trained, psychologists who are trained in PTSD and readjustment and bipolar diseases. And so I see your work, I see your hard work, and I'm proud to work with the veterans, and I think it's a privilege to work with all of you. You're some of the smartest, most caring people that I've ever encountered in my career. It's fun to go to work. And that's all I have.
Good morning. My name is Angela Goodwin. I'm the Caregiver Support Coordinator at the Marion EPA. And Krusty Patterson, who's the Caregiver Support Coordinator who serves the Evansville area, was originally going to be here, but she wasn't able to, so I'm filling in today. I'm here to talk about resources for families of veterans. Okay. All right. There have always been a lot of programs and services available for veterans, and a lot of those in turn do benefit the family members who are helping to care for the veterans. In 2010, there was a law passed that developed the Caregiver Support Program. And there are a lot of different parts to that program. One being specifically for the returning veterans, the Iraq and Afghanistan veterans, and the family members who are helping to care for them. But also, the program is there for all caregivers of veterans. And the mission of the program is to promote the health and well-being of family caregivers who care for our nation's veterans through education, resources, support, and services. First of all, what I want to talk about are those programs that have been around for many years prior to the implementation of the Caregiver Support Program. So we're going to go over those. And start with in-home and community-based care. And each one of you will have a packet of information about the different programs that's included in the registration packet that you received this morning. Skilled care. Skilled home health is available for veterans who require things such as physical therapy, occupational therapy, speech therapy in the home. And what the VA does is contracts with agencies in the community to provide this care. And oftentimes it's for a veteran who's had hospitalization and is discharging and needs that care in the home. And the next one is homemaker and home health aid care. And this is basically where the VA, again, contracts with providers in the community to provide a trained person who provides in-home assistance with personal care and household tasks. And a homemaker home health aide works in the home with the veteran and provides care such as assistance with activities of daily living, so bathing, eating, dressing, grooming, any type of personal care. And these services obviously are beneficial to the veteran, but they also help the family members because it's allowing someone else to provide that type of care for the veteran while they're focusing time on completing other tasks or even just relaxing while someone else cares for the veteran. Hospice and palliative care is something that the VA does provide. Hospice care can be provided in the home through a contract with a local hospice agency. Or we also do provide inpatient hospice care for veterans through a contract nursing home, which is a facility the VA contracts within the community. The biggest difference between hospice and palliative care is that hospice is comfort-based care for veterans who have a terminal condition of 6 months or less to live. Whereas palliative care is also focusing on comfort care, but it's for veterans who have a life-limiting illness but have not had that 6 months or less time frame provided to them. We also have telehealth. Telehealth is a service that allows the veteran's physician or nurse to monitor the veteran's medical condition remotely using home monitoring equipment. It's a pretty cool program. There's a little device that the veteran receives that plugs into their phone line or internet connection or even a cell phone connection. What it does is each day the veteran would go to the device and they would ask them questions, they would input information, and it allows the care coordinator to monitor their condition. And if something of concern comes up through the information that they input, that care coordinator can contact them, kind of find out what's going on, and troubleshoot, problem solve, and also notify their provider of any concerns that have been discovered. Then we have home-based primary care. Home-based primary care is a program that provides healthcare services to veterans in their home. And it replaces a veteran's primary care clinic, and it's an interdisciplinary team. It consists of a medical director, a mid-level provider such as a nurse practitioner, nurse, occupational therapist, pharmacist, social worker, and dietitian. And all of those service providers come into the home, complete an assessment, and then they have a plan of care to treat that veteran with a chronic health condition. And let's see, contracted adult day health care. The VA has contracts with adult day facilities in the community, and these programs allow veterans to attend the facilities to receive socialization and services that get them less isolated. Also, they can receive things like medication, dispensing, bathing, and interaction with peers and other veterans oftentimes that are attending the same facilities. This also allows the family members who are caring for the veteran to get a really good break. If the veteran is going to the adult daycare facility 1 to 5 days a week, depending on their needs, that's time the caregiver can relax, can get some things done, and can take some time for themselves. Community nursing homes, state veterans homes, community living centers. The community nursing homes are, again, nursing facilities in the community that the VA contracts with, and eligible veterans can receive care in those facilities. The community living center, we have a facility on the Marion campus, and that, at this point, primarily focuses on veterans who need short-term rehabilitation and hospice services. And typically, each VA has a community living center. There are some long-term patients in the facility, but again, the focus these days is more on the short-term rehabilitation and hospice services. And state veterans homes are monitored by the VA, but they are state ran. So each state often has these homes and has an application process where veterans can enter these facilities to receive long-term care services. Respite Care. This is probably one of the most beneficial programs for families of veterans. Respite Care allows someone to come into the home and sit with the veteran while the caregiver takes a break. So it's up to 6 hours per day, and the veteran receives 30 days per year. In addition to the in-home respite, a veteran can also utilize inpatient respite, and that is provided at a VA contract nursing home or our CLC facility, and that's for 24-hour care. So if the veteran wants to come stay, 2 days to a week, whatever their needs are, that allows the caregiver time to rest and do things such as take a vacation, go visit family members, while the veteran is receiving the appropriate level of care. A few other family support services that have been around for several years, things like support groups, pastoral care, temporary lodging in Fisher houses, and the VA hotels. Most commonly, the Fisher house that the Marion VA utilizes is the one at the St. Louis VA. If a veteran is at that facility inpatient, say they've had surgery or they're there for a higher level of care, the family member can stay in the Fisher house at no cost. Also, the VA hotel, if a veteran, say for example, has a procedure at 6 a.m. they have to be there for, and they live, an hour or two away, they can arrange, the veteran and family can arrange to stay at the hotel the night before so that they don't have that early morning drive the next day. This is where I noticed an error in my PowerPoint this morning, last night when I was looking over it. Some other benefits, assistance for home, or it says automobile medications. It's supposed to say modifications, so I noticed that and I was like, automobile medications. So it's supposed to say modifications. Things like the HISA grant that can make a home more handicap accessible, build a modular ramp on the home for veterans who have accessibility issues. Durable medical equipment. The VA can provide, if clinically indicated, canes, walkers, wheelchairs, hospital beds, ramps on the home, as I mentioned. So things that help the veteran to become more independent. It also helps the caregiver. If you have a spouse who's having to lift a veteran in and out of the tub or lift them in and out of the bed, if we can get a hospital bed that raises up and down to save the physical stress they're putting on their bodies, then that's what we want to try to do, to keep them in the home as long as possible. Sensory and prosthetic aids, transportation for veterans to medical appointment for those who are eligible for travel. All right, so in addition to all these services that have been around for a long time, after the law was passed in 2010, all VAs were required to hire caregiver support coordinators to implement the caregiver support program. And with this came some newer services for caregivers. And these are for all era caregivers. A lot of times in the news you hear about Comprehensive Assistance for Family Caregivers program. And that is the program for the returning veterans who were injured in the line of duty on or after September 11, 2001. And that's a whole separate part of the program, but all caregivers have these newer programs that the VA started, one being the Caregiver Support Line. And this is a toll-free number for caregivers, veterans, or community partners to call for supportive counseling, information, education, and referral to community and local resources. And also it connects them to their local caregiver support coordinator. The monthly Caregiver Support Line education calls. These are basically where a caregiver can call in each month, and the calls focus on strategies to enhance resilience and restore balance. And they're facilitated through the National Caregiver Support Line. And each month there's a different topic that's relative to caregiving, and it's offered 3 times during that month, which allows some flexibility for the caregivers to be able to call in. Another new program offered is the Building Better Caregivers program, which is a 6-week online interactive workshop for caregivers who are caring for a veteran with a variety of different issues, things like dementia, PTSD, a brain injury, or any other kind of serious injury or illness. And the workshop helps caregivers in 2 ways. Number 1, it offers training on how to provide better care, and then it also helps them learn how to manage their own emotions, stress, and physical health. We also have a caregiver website, which is a great resource for family members of veterans. It looks at specific diagnosis. It looks at information, resources. It provides a section where they can click on different individuals and learn their caregiving story and feel connected to someone else who may be going through the same thing that they are. And they can also sign up for to receive emails on specific topics through the website. Another thing the VA has been active in since the implementation of the program is the celebration of National Family Caregivers Month, which is in November every year. And it focuses on caregiver awareness, educating the community about the role of caregivers, educating providers in the facility about the role of caregivers. It's kind of always the old medical model. You just work with the patient, and a lot of times, the family members ask to leave the room. Well, in situations where the veteran has a caregiver, oftentimes that caregiver needs to participate in the treatment. They need to know what's going on, particularly if you have someone with a memory issue who may leave the room and not even remember what they talked about. So really trying to educate staff on the importance of the role of caregivers and family members. We do have, during November, several education opportunities for caregivers. We try to do outreach within the community and at the VA facilities. And we also have a caregiver retreat at the facility where caregivers can come and learn. We have a workshop in the morning, and in the afternoon we have some caregiver pampering, so they get many manicures, chair massages, that type of thing. Just to recognize their hard work and give them a day to get out and meet others, and the opportunity to, again, connect with someone who may be going through a similar situation. All right, these are just a few more programs and services that the VA offers. Chronic Disease Self-Management Program. It is a 6-week program where veterans learn to better self-manage their health, to take charge of their health, and be a partner in healthcare with their healthcare providers. The MOVE program, a weight management program, it looks at things, your traditional nutrition and physical aspects of weight management, but also includes a psychological aspect of weight management. Sit and fit exercise class, diabetes education class, support group, and tobacco cessation. The good thing for family members is that most of these groups the family member can attend with the veteran. So not only does the veteran benefit from the information and the skills that they learn through these programs, but the caregiver is able to take those skills and encourage the veterans to continue them at home. And also, it will benefit their own health. If they happen to have a condition of their own, they can improve their health, which always, if you have a healthy caregiver, then in turn they can provide better care to the veteran. All right, I left some time for questions if anybody has any. And there is an information packet in your folder, and it includes my contact information. So if you have any questions, feel free to give me a call. All right, thanks.
Good morning. My name is Alicia Burris. I'm a social worker. I'm currently working at Deaconess Cross Point on the care team. I just started that job 4 weeks ago, so I'm brand new to that position. But prior to that, I was working as a family assistance specialist for the past 5 years for the Indiana National Guard. I'm also prior service Army Reserves, and I'm a military spouse. And I have 3 military kids. So, this morning I'm going to talk to you a little bit about some resources in your community, or your communities, for veteran and military families. Now, there's a lot of resources out there, so I could list all of them. I could go through a long PowerPoint, but I'm not going to do that. Okay? In your packet, you got a resource guide, so I want to call your attention to that, or if you don't have it right now, look at it later. But this was formulated by the Tri-State Military Resource Network group. I see a lot of familiar faces in here who know about that group. But this is just a snapshot, and I just pulled some of the things out of that resource guide that they've been working on that focus on military and family veterans, or military and veteran families, excuse me. This guide, like I said, is just a snapshot, and of course it's ever-changing and ever-growing. Those of you who are from Evansville know that we have a very patriotic community. I brag about Evansville all the time when I go places because our group, the Tri-State Military Resource Network group, is one of the largest attended in the state, which is amazing. So I highly recommend, if you want to know more about resources and share your resources for veterans and their families, that you come to one of these meetings. This is part of an initiative called the Joining Community Forces Initiative, and it's a great way to learn and share and also to network with other agencies that are working towards goals for veterans and military families. This is typically facilitated by MFRI, depends on where the group is located. Our group here in Evansville is facilitated by, the Military Family Research Institute, Mark's looking at acronyms, right? But here in Evansville it's facilitated by them. But in other areas it can be facilitated by a family assistance specialist, which I'll talk about in a little bit as well. The one here in Evansville, it's held on the last Thursday of each month at the Evansville Armory from 10 to 12. If you'd like more information about joining that group or getting involved with that group, then you can contact MFRI, or you can contact your local family assistance specialist. But again, great way to network, great way to get involved and see what's out there in our community. And a lot of resources that are in that resource guide, of course, are here today. So I highly encourage you today to go out there, look at the tables out there, the vendors that are here today, get information, share those resources with your agencies, back where you are. So let's talk a little bit. I mentioned family assistance specialists. Let's talk a little bit about what that is. So family assistance specialists, they work for the Indiana National Guard or the State National Guard, but they serve all branches of the military. That includes veterans, that includes retirees and their families. Each state has family assistance specialists, and in Indiana there are 13 locations that cover every county. So they go anywhere from Evansville up to Gary to Fort Wayne, New Albany, so they're all over the state and every county is covered. These folks are a really great resource and they're considered a one-stop shop for resources for veterans, for family members and military folks. They can help you connect to resources. And one of the main things that we do as family assistance specialists that family assistance specialists do is they maintain what's called a SMART book. And a SMART book is basically just a list of community agencies that are available in each county. They can also connect you to statewide programs such as transition assistance. Mr. Peterman is here today with transition assistance, who they help veterans connect to their benefits and learn and know what their benefits are and kind of navigate through the system. Did I get that right? But also they can connect with financial resources, legal resources, crisis intervention resources. The main thing is financial resources, and most of you probably out there know that's one of the top needs. This afternoon, I'm going to be talking a lot more about special issues and concerns that face military and veteran families. And in that, I'll talk about some of the resources for each of those needs. So if you have any questions of me until then, I hope to see you this afternoon, where I'll be talking about this. But I also have with me family assistance brochures, so that if you want more information about where they're located, you can grab one of those from me. And then I'll tell you what our essential services are as well. Okay?
Before we have our first speaker, I did want to make mention of the Community Development Financial Institutions Fund packet that is located in your folder as well. At some other time, if you want to browse through this, it talks about different kinds of awards and grants. I'm not a money person, so I can't explain it to you, but we copied it, and there was a request that this be sent out to all of the mental health summit participants. The other thing that I think Dr. Sanabria mentioned this, but we may not really realize, but this is being video streamed our whole day today to Carbondale, to SIU, as well as to Jasper Memorial Hospital. So we do need to give those folks a round of applause also for partnering with us and being willing to be our host sites as well. So if we could give them, hopefully they can hear and see us. Joel and I were a little nervous earlier, and we checked it out, and the other good thing is people can actually get onto the web right now and see this. So I do have one of our doctors in Marion right now is probably watching it. So we want to thank USI for the technology. Our first speaker is Lori Buzon. Yeah, I know that your agenda says Clint. She doesn't look anything like Clint, but we want to welcome Lori to come on up, and she's going to just tell you a little bit about her story. Our three veterans that will be talking today after our little break, they'll be breaking out. Each of them will go into a room, and you can choose which room you want to go into to talk with them, and we'll have some community discussions. So come on up. Thank you, Lori. Thank you.
Hi, my name is Lori Buzan, and I'm here to tell you a little bit about myself. They say that you live life forward, you understand backwards. So I understand very much now that I'm older that my problems started when I was little, and my home life was very volatile. And in dealing with that, I ran a lot. I would run away, hide, and then I started abusing substances. And muddled through that, just would go ahead and get through what I could get through. About 20 years ago, I had 3 very traumatic things happen all in succession, and I really was suicidal. I'd come to Evansville, and I can't even tell you where I went. I went to somewhere to get help and was turned away. Went home. By the grace of God, I made it through this. And I've used more substances, it got worse, it just kept getting worse. And to tell people, when I came to Evansville and got turned away, no one ever asked if I was a veteran. I never knew there was veteran mental health services available. I never knew. So that would be one thing that would help veterans, is if people in the ERs, people that are coming in for services, ask them if they are a veteran, if there's any way they can get veteran services that way. 3 years ago I came here and was one of the first people that got the HUD BASH voucher. And that program has been just amazingly great for me. It's helped me step by step through a lot of things. I've been clean for 3 years. 3 years. And from the words of Maya Angelou, when you give, and when you learn, teach. So if there's any way I can help them better, get better services, this is what I'm here for. Thank you very much.
We want to thank you, Lori. We know this is scary. This is scary for everyone, but we appreciate that. And Heather Suckles is our next veteran speaker, so if we could welcome Heather.
Good morning, everyone.
Good morning.
My name is Heather Suckles, and I'm honored to have the opportunity to come and speak to you today about my experience and how the VA has provided me with education and developed the tools and coping skills that are necessary for me to live a better quality of life. I'm a U.S. Navy veteran. I served 5 years as a photographer's mate. I was very successful in that I started at E1 and was advanced to E5 in an overmanned rate in 4 years. I received a Navy and Marine Corps Achievement Medal, many letters of commendation, and was honorably discharged in 2001. I registered with the VA immediately on transition back to a civilian. I want to cover briefly about my experience before vet court, the education I received during vet court, and my life today. I was in and out of jail starting at 30 for drug-related offenses. I started using drugs very, very early. And I actually went into the Navy on a drug waiver. So the Navy gave me an opportunity. I managed to stay clean off illegal drugs for 6 years, but I became an alcoholic. And so I was discharged, moved to Buffalo. I was married. I got a wonderful job at UPS. I was supervisor for 2 years. And I was also a full-time college student. And I went to college for 2 years. Never did finish my degree. And then my marriage failed, and came back to Evansville, I pretty much immediately was in contact with the drugs that I was involved in when I was a teenager. And since I did have veteran or VA benefits, I wasn't really concerned about getting a job that required me to have any kind of insurance because I really didn't need it. My health was taken care of. And so I had no incentive to do any better. So I just worked at places like TJ Maxx and, and just started to gradually get back into drug use. So from 2007 to 2012, I did not have a job. I did attend Ivy Tech for 2 years, and I ended up dropping out of college again. And so from 30 years old, I'm 38 now, I have been to jail, I would say, 20 times. Finally, in 2001, April, I was arrested once again. I had just gotten out of jail. I had just gotten out of trouble. And I was picked up and arrested for methamphetamines and prescription drugs. I had to hire a lawyer, and he wanted to see my medication. So I brought them in, and he was looking at them, and of course, VA label was on them. And he said, "How are you affiliated with the VA?" I said, "Well, I'm a veteran." And he said, "You're a veteran, okay, well, there's a vet court." And I never heard of it before. And he said, "But I haven't had any luck with it at all." And he said, because I guess the other people were not on religious charge for some reason. And I said, "Well, I know that I was on religious charge. Maybe I have a chance." So he did work with me. We were able to get the prosecutor to grant me vet court. So I was accepted into the forensic diversion program. I went down, checked in at the jail, which is where the drug court is, and I failed the drug test. So then he immediately put me back in jail for about 3 weeks. And I was sitting in there, and everyone was like, "Okay, when you do this, you're still good to be in the program, but you have to go to rehab, stepping stone." And I was like, "Okay, stepping stone, well, that's fine. I can't wait till they come get me." And I'm sitting there, and there's other girls coming in, and they're leaving before me, and I'm wondering what is going on. Finally, the Veterans Justice Outreach came to see me, and this man from Marion told me that I was going to Marion, Illinois, to the RRTP, which is the Residential Rehabilitation Treatment Program. He said I could be there for up to 8 months, and I was like, "No, I cannot go there. I do not want to go there. I want to go stepping stone." And it ended up being the greatest thing that happened to me. While I was there, I met a lot of wonderful people. I was in classes such as early recovery skills, relapse prevention, depression, dual diagnosis, cognitive behavioral therapy, nutrition, and vocational rehab, which will lead me to my next topic. I also, before you were able to, I could complete this in 4 months, by the way. I thought I was going to be there for 8 months. I had to have a place to reside, and I had to have some kind of income, transportation, and a support group. The Lucas Place 2 accepted me for an apartment there. And I was just talking with some other veterans that were in rehab with me, and I had heard about a program program called compensated work therapy. And plus I was in a vocational rehab class, and so I started asking questions, and I was able to work at the VA under compensated work therapy, and it got my foot in the door at the VA, which really, really helped me because I had a lot of resentments about things that I had done and lost everything that I was so proud of. But being around the veterans, working with them, it helps me to forget all that. It didn't matter anymore. I was finally happy. The CWT program was designed to help veterans develop good work habits and job skills. After 9 months, I was able to apply for a full-time position at the VA, and they hired me. And I've been promoted ever since. I actually am a work leader in the surgery department for EMS, which is the Environmental Management Services. And working with the veterans, I gained pride, self-esteem. I was able to let go of resentment. With a clear mind, I am now able to set short-term goals and accomplish them. Seek spiritual guidance and plan for the future. For the last 2 years, I have been trying to restore my credit. I have finally done that, and now I am eligible for a VA home loan. I've never had my life is much more enjoyable now. I finally have a purpose. Therefore, I can continue to improve myself and move in a positive direction. In closing, I really want to thank Vet Court, the RRCP, Echo Housing, Vocational Rehab representatives in Marion, the entire Candy staff, my sponsor, Candy. Without the acceptance and guidance from them, I would not be here today. Thank you.
Thank you, Heather. Our last speaker is Ethan Pendleton. We'd like to welcome Ethan. He came all the way from Owensboro today, so we're glad he made it bright and early this morning.
Good morning. Before I get started, I want to thank the two gentlemen that came from Owensboro, VA, just to be here to support me. If y'all would stand up for me. I was created by two hardworking, honest, wonderful citizens who raised me in a Christian household. And I must say, I had a good upbringing. I went through the normal teenage crap. I didn't have any neglect or any abuse at home. I grew up in Sacramento, Kentucky, and I attended Sacramento Elementary School from kindergarten all the way to 7th grade. And then in the 8th grade, I transferred to McLean County Middle School. And from there, I went to McLean County High School and graduated in the year 2000. In 2000 and 2007, I worked full-time. Usually I had a second job whenever I could. I went to college, and I raised 3 kids. But in the back of my mind, I always wanted to serve. Then in 2007, I joined the military, I joined the Navy. And the military was the best choice I ever made, honestly. I was stationed in Norfolk on active duty. I served in the Persian Gulf during the global war on terrorism campaign. I wasn't on the front lines, but even though I wasn't, I feel like the emotional situation is still the same. But I can't imagine what my other brothers and sisters that were on the front lines with her. When I got out of the military in 2010, I made a decision to not re-enlist and receive honorable discharge. This was hard for me to do, especially when I had other friends and, I would say brothers and sisters. That's how I felt. It was like family. We got close. They were still in and I wasn't. I was back home, and it made me feel grief, depressed. I felt obligated that I still needed to be there fighting with them. But at the time, I didn't realize the effect my military service had on me both physically and psychologically. And then that's when I saw help in the VA, because I knew I was having a lot of overwhelming problems. And honestly, I didn't know how to live anymore. I didn't know what I was going to do with myself. And at the time, I didn't know what to do, period. I was lost. I started encountering emotional, legal problems, physical, spiritual, and social issues. I couldn't even walk in public places, malls, and stores. It was too much for me. I had to wait and try to wait for crowds to leave stores, or I'd go store to store until I found a place where it was not very many people where I can go in and shop. I'd go in stores, shop at 2, 3 o'clock in the morning. I had a rough job. I just couldn't deal with life on life's terms. But the VA gave me my life back by providing me with the various services, mental and physical health issues that I had. Today, with the support of the VA and the benefits they provided me, in December of 2014, I graduated from Western Kentucky with my social and behavioral science degree. So, who's hiring? With that being said, I need a job. But today I'm able to deal with difficult situations. I feel like the experiences that I've been through, I now have empathy and ability to spot things out in people that before I wasn't able to spot out. Especially when it comes to intervening and helping somebody with homicidal and suicidal ideations. I've learned new coping skills, so I'm able to deal with life on life's terms again. Yeah, don't misunderstand that I still have both good and bad days still. But the physical, I feel like we can overcome. It's the things we can't see that keeps us from functioning. The emotional and mental issues at times are overwhelming. And I believe you just can't slap the cast over it. And as a man, we're taught about bravery and courage. And honestly, I can tell you today it takes more courage and guts to talk about how I feel rather than pretend and shut my mouth and act like it doesn't bother me. And that's all I want to say right now. I'll keep it short and sweet, but thank you.
Thank you, veterans.
Yay.